Well, South Africa is observing Child Protection Week 2023. The week is used as a way to shine a spotlight on the rights of children as enshrined in the Constitution. The week is led by the Department of Social Development in partnership with other government departments and NGOs working towards safeguarding children. This year's theme, Let Us Protect Children During COVID-19 and Beyond. Government has called on everyone to lend their support to the initiative. It focuses on breaking the cycle of neglect and abuse inflicted on children. South African children are part of the society with a constitution that places their rights at the top of its priorities, ensuring equality and dignity for all. The government says that the commitment to shield children from harm is not just a noble value, it's a binding duty outlined in the Article 28 of South African Constitution. The government also encourages everyone to wear a green ribbon during Child Protection Week as a symbol of support for the promotion of children's rights, care and protection. The colour green signifies life and growth, and wearing the ribbon is this week shows support for the initiative. Right, well, as the winter season creeps in, it brings with it flu and other respiratory illnesses. Should those who recovered from COVID-19 be worried? A child health specialist at the health department, Dr. Lesley Bamford, unpacks this for us. A very good evening to you, Dr. Bamford. Thanks for joining us.
Good evening, and good evening to the viewers.
All right, Dr. Bamford, let's talk about whether there is, a bigger concern for those children who have perhaps recovered from COVID-19, and why the focus this time on children when we're talking about COVID-19.
So with regards to COVID, we know that children were relatively spared with regards to COVID infection.
Yeah.
COVID disease predominantly affected adults and to some extent adolescents, but mostly older and particularly older adults. We do know that one of the impacts of the COVID pandemic, all the disruptions to services and to life in general, did result in some children missing out on being immunized against other common or uncommon vaccine preventable diseases. And so we know that we need to, on an ongoing basis, protect children against these diseases, and make sure that they are all vaccinated. Those who are due for vaccination also catch up doses for children who may, for one reason or another in the past, have missed doses.
In fact, I read a report that the COVID-19 pandemic actually disrupted a lot of the, the vaccines that, children were supposed to get. What was the reason, for this? So the fact that there are many children who are, in fact, behind on other vaccines. Of course, I'm not talking just about the COVID-19 vaccines, just general vaccines.
So, in fact, in South Africa, we were relatively spared. Certainly during the hard lockdown, we saw a drop in the immunization rates. I think that was a result both due to disruption to health services. Sometimes services being closed, health workers being assigned to other tasks, and also people were fearful to visit our health facilities. However, straight after the hard lockdown, we ran a very successful catch-up campaign. And so our immunization rates have returned to levels that are higher than before the pandemic. But nevertheless, not all children are vaccinated. We have suboptimal vaccination rates in the country. So there are children who, due to the pandemic, but also due to other reasons, have missed out on doses. And we do continue to encourage their parents and caregivers to bring them to our health facilities for, as I say, routine vaccination or for catch-up doses.
Doctor, as you mentioned, children did appear to be largely spared from, direct COVID-19, fatalities, mortality, and really the impacts really of COVID-19. But, we're talking about the fact that, winter is here, we start to see flus, colds and so forth. So there is something we should be concerned about. What are the things that we should be worried about now that, winter is here?
Well, certainly during winter, I think it's really the parents and grandparents that we are most worried about. So we continue to encourage adults, particularly older adults, to be vaccinated against COVID. We know our number of COVID cases is low, but there continue to be cases.
Yeah.
And older persons and people who are vulnerable for one or other, other reason, should also, wherever possible, receive the flu jab to protect them from influenza.
Yeah.
Those influenza in many cases is mild, but in older people, people with other health conditions, it can be a very serious illness. And the flu vaccination provides very good protection against such episodes.
All right, let's talk about Child Protection Week. This year's theme being Let Us Protect Children During COVID-19 and Beyond. Your thoughts on this particular theme for Child Protection Week?
So certainly, within the health department, we have a campaign called the Side by Side campaign. Our Road to Health booklet is based on that campaign that really looks at the things that children need to be happy and healthy. And one of the key issues is protection. And children need to be protected in different ways. Children need to be protected from illness and disease, but they also need to be well looked after, well supervised, and protected from abuse and from neglect. And our view is that everyone should play a role in protecting children in their households, in their families, but also in their broader communities. It's really something that requires everyone to be active and to play their part to make sure that our children are safe and protected from harm.
Yeah, there's particular emphasis on the need to break the cycle of neglect and abuse inflicted on children. As the health department, I would assume that you get those sort of stats, and you have a clear picture of what it looks like in South Africa when we're talking about neglect and abuse of children. Could you possibly paint a picture for us of just how how serious this situation is?
So we work closely with our colleagues in the Department of Social Development who do take a lead with regards to protecting children from abuse and neglect. Obviously, as the Health Department, we have a very important role in ensuring that we identify children who are at risk, that we provide them with immediate care that they might need, and that we make sure that they receive the other services that they require. So we know that in South Africa, many children do face abuse and neglect for many reasons. And as I've indicated, it really requires a whole range of stakeholders to be working closely together to make sure that we both, wherever possible, prevent abuse and neglect, but also respond and protect children who are experiencing abuse and neglect.
All right, Dr. Lesley Bamford, thanks very much for giving us your time. We certainly do appreciate you talking to us here on SABC News. Thank you.